Nikolai Petrovsky is Australia's leading authority on vaccines and a professor of medicine at Flinders University. He's also the founder of Vaccine, which has developed a synthetic protein-based vaccine for COVID, which is being sold in a few countries around the world, except here in Australia. Now, Professor Petrovsky is concerned around the push to have children as young as 5 about to be given possibly access to the vaccine, with Pfizer making an application for approval with the TGA. Welcome, Nikolai.
Welcome.
Now, you have some concerns around the possibility of 5-year-olds being given access to vaccination with Pfizer's mRNA vaccine. What are those concerns?
So it's really about the amount of data that's available to support the long-term safety of these vaccines in young children. We have to remember that the mRNA vaccines were only started to be used in adults, some 8 or 9 months ago. And so we don't really have any data on their effects in children. And although, they are starting to be used in children, some of us at least are just concerned that we need more data, that it's a step too far to race to give these new technologies to children. So I guess it's a conservative view because, when I did medicine, we're always trained first do no harm. And particularly if we're dealing with vulnerable individuals, whether that's pregnant women or young children, we need to be doubly cautious, or at least that was my training. We don't seem to be following those rules here. And so hence my desire, I guess, to have more data before I would be supporting such a move.
Now, is there anywhere in the world that has approved vaccine for children that young, and anything we can glean from that?
So certainly, they've progressively been getting approvals at younger and younger ages in other countries that are leading this, particularly the United States. But of course, the only data, even there we have is data that's only months old. And so there is no way we can say that, this might affect children's development as they go through puberty, where their biology changes very dramatically. How can we say without, a long-term study that isn't going to cause some disruption? And so that's my concern, particularly as an endocrinologist who looks after issues like puberty and developmental issues, is we're putting an unknown variable in here, and we simply don't have any long-term data. So there is a risk associated with that, which you can't quantify. Might be a small risk, might be a large risk. The problem is we simply can't quantify it based on existing data.
Now, the whole risk-reward ratio that we look at with most medical interventions, are the risks for children at that age, from the 5 to 9-year-old, from COVID? We have some data on that, don't we?
We do, and clearly the impact of COVID is very much on the elderly, who have a very high risk of hospitalisation and death. And conversely, we know in young children and young adults that those risks of severe disease and particularly of death are dramatically lower, hundreds of fold lower than we see in the elderly population. So you're right that the risk benefit needs to take that into account. So in an elderly person, obviously the benefits are going to be very large if they can prevent those common events. If those events are very rare in children, then a rare risk may now sort of take precedence and may actually argue against an approval of that particular product, in a child versus an adult. So it's all about risk benefit, and that's a very complex, calculation to make, particularly where you have these additional unknown variables, such as what actually is the long-term effect of these new technologies in the context of a developing, or a child growing up, going through puberty.
Now, as far as the whole risk-benefit goes, the vaccine companies themselves have had their risk to exposure to wrongdoing removed as they would normally be held to account. Is that a correct understanding?
So certainly the companies demanded an indemnity against any litigation for side effects of their vaccines as part of agreeing to supply those vaccines. Now, that doesn't clear them, I think, of wrongdoing or negligence, but what it does mean is that if anyone has a side effect of these vaccines in Australia, it's the Australian government who will be responsible for paying any damages. It won't be paid by the company. But as I say, if there was clear wrongdoing or criminal negligence, that I imagine, I haven't seen the indemnity agreements, but I would imagine that would not be indemnified. Normally you can't indemnify against criminal behaviour.
Now, Pfizer's step of seeking approval, can you walk me through that? I don't understand clearly what it is Pfizer have now said to the TGA and what this step actually indicates.
So this step is a pre-request to the TGA under their conditional approval, or what other countries call emergency use approval, to enter that pathway. And so first you have to make a case that there's an emergency. In this case, if you're applying to give your vaccines or to young children, you have to say there's an emergency need for a vaccine for young children. If the TGA agree that there is an emergency need for a vaccine for young children, then they'll agree to accept an application or a dossier with all of the data to support that application, so that they can make a decision, do they approve it or not. So it's a two-stage process. First, you have to show that there is an emergency, and then if that's agreed, you can submit your dossier to have it assessed. So at this stage, the TGA has not assessed this on its merits. They're just assessing it. Is there a need to assess it, to assess the dossier?
It sounds a very convoluted process to go through. Now, your protein-based vaccine, synthetic protein-based vaccine, is now in use in, is it Iran?
Yes, so we undertook our phase 3 clinical trials in Iran. So that's where we proved that the vaccine was clearly protecting against the Delta variant, and on the basis of that, the Iranian FDA has granted marketing approval for the vaccine in Iran.
Okay, and will this be in children as well, Nikolai?
No, so initially this will be in people aged between 18 and over. Obviously, we need to do clinical trials in children to again establish that the safety and effectiveness we see in the adults extends to children, which we obviously strongly believe it will. Once we've done those clinical trials, then we could apply for an extension of the approval to children.
And how long would that process take for your vaccine?
So it's really a question of resources. The less resources you have, the more time it takes, unfortunately. And clearly we don't have the resources of a Pfizer, or the size of income that, the government has been obviously giving to companies like CSL. So we're trying to do it as fast as we can. But as I say, we have to take into account the limitations due to, manpower and resources.
All right, so final question, Nikolai. As a concerned parent as myself, traumatised by the messaging and the misinformation that's been around it, 9-year-old daughter. Which way do I go? Do I vaccinate? Should this be approved, or do I hold off?
So that's a question that I guess each parent is going to have to make. No one can make that decision for them, and certainly no one should have the right to make that decision other than the parents. First of all, of course, there needs to be, vaccine approved for that age group before you even have to make that decision. But as I say, ultimately, every parent is going to have to look at the data and ultimately make a decision. Is the risk benefit relationship, as they perceive it, support immunising their children? It's going to be a tough decision, I think, for all parents.
Great. All right, Nikolai, thanks so much for your time today on The Informer.
It's a pleasure.